With us now, Dr. Amish Adalja, infectious disease and critical care physician, also teaches at Johns Hopkins, joining us from Pittsburgh. All right, Doc, if monkeypox gets out of control, which at least has the potential to, what's the worst case scenario?
The worst case scenario is this becomes a day-to-day infection that we have to deal with outside of the endemic countries where it's always been, and that we have to vaccinate more broadly. It's important to remember that not every virus has pandemic potential. I think the worst monkeypox gets is that it becomes something that is in certain populations that we deal with it as an infection, but it's not going to have the same disruptive effect as, for example, COVID-19 had. But I think we still can contain this. We have medical countermeasures that work. We just have to deploy them competently.
You say deploy them competently. Every time we hear about monkeypox vaccines, something that's been around for decades, all we hear about is shortages.
That's definitely the case. And that's because what we're using is a second generation vaccine against monkeypox, and it's in short supply. And there had been some efforts to stockpile it, but clearly not enough. And I don't think anybody envisioned monkeypox causing an outbreak outside of the endemic countries in the way that it has. And I think we will catch up, but there's still going to be some time before cases continue to increase until vaccine is able to intervene. And I think that New York City, for example, prioritizing first doses is going to help, but we need more of it. And maybe we have to think about using the older first generation vaccine in those people who are willing to take it, who don't have any reasons not to take it in terms of medical conditions. Because I think that this is something that can be stopped if we actually take action.
As you think about the CDC and NIH dealing with, as you talked about certain populations, primarily among the gay population and where there's spread, especially in Europe, at some gay festivals and then into the United States. Have you seen a reluctance by the CDC and the NIH to talk about things in stark terms because of the potential political correctness implications?
Not completely. The CDC has been pretty forward with where this is spreading. And I think that we had seen some reticence among other public health authorities to talk about where this was spreading. And I think that didn't do that population much of a service, because what we want are people that are at risk for being exposed to know about it, to take actions, to get vaccinated if it's available in their area, to think about testing if they have symptoms that are consistent with it. And I don't think that it's stigmatizing to say that this is spreading primarily amongst men who have sex with men. It actually reflects the epidemiology and helps them take action. The CDC has been saying that. I think what we've seen is a lot of people kind of stepping around that. But when it comes to controlling this outbreak and using the vaccine most judiciously, it has to be in those populations that are at highest risk. Although anybody can get monkeypox, the unique circumstances of this outbreak really have concentrated in this population.
So much of the trust of public health officials has been just tossed out the window over the past two and a half years or so of COVID. I remember you and I talking at the very, very beginning of the pandemic, and you were one of the few doctors who would say, I don't know, we don't know, we're unsure about COVID. How do you get that trust back in a situation where it's so imperative to have it?
I don't know the answer to that. This is something that is going to be very difficult because we've seen such erosion of trust. We've seen public health and infectious disease kind of get sucked into the vortex of identity politics. And that's going to be something hard to come back from. And it's going to hurt all of us, because if people aren't listening, they're not going to take the best actions. Our political leaders aren't going to think about public health as something that they should really consider the way they consider national defense, but think of it as something as part of their political agenda. But it has to be with being truthful to the public, by being transparent, by talking about what we do know, what we don't know, what questions we're asking. All of that has to be part of how experts communicate to the public. And maybe over time, some will start listening to us again.
Yeah, trust, as we know in this business, is hard to earn and easy to lose. Hey, Doc, it's always great seeing you. Thank you, and thanks for staying up late with us. We appreciate it.
Thanks for having me.
Yeah, it's good to see you. All right.